Im. Assalamualaikum warahmatullahi wabarakatuh and greeting to Professor Madya Dr. Haji Muhammad Shanawi. Today, our group will present on our research of the effect of perceived appearance-based scrutiny on social anxiety levels in young adults in Klang Valley. My name is Rosita Hana and I will be the first presenter for today. Here is basically the agenda of today's presentation. What is perceived appearance-based scrutiny? Perceived appearance-based scrutiny is a subjective cognitive state in which an individual believes or feels that others are actively watching, evaluating, and critically judging their physical appearance. And how about social anxiety? Social anxiety is an intense, persistent fear of being watched, judged, or humiliated in social situations. It goes far beyond typical shyness and can severely disrupt your daily life, making everyday interaction like public speaking, eating in public, or meeting new people feel overwhelming. Now, let us turn our attention to the visual core of our theoretical framework. In young adults, social anxiety is deeply intertwined with how they perceive themselves in the eye of others, a phenomenon we define as appearance-related anxiety. To understand how this condition takes roots, we must examine the vicious cycle of appearance concern, which is driven by three interconnected forces: developmental transition, digital environment, and cognitive feedback loops. We begin with our first pillar, transition, vulnerability, and self-worth. Young adults, specifically between the age of 18 and 24, is a turbulent phase where reliance on peer validation peaks. According to Manzoor, this rapid period of change leaves individuals highly susceptible to peer evaluation and external beauty standards. When they feel they do not fit the societal mold, their physical self-worth plummets, threatening their sense of belonging and making them incredibly vulnerable to appearance anxiety. This vulnerability is dramatically amplified by our second pillar, digital comparison and hyper-scrutiny. On highly curated platforms like Instagram and TikTok, young adults are subjected to a relentless stream of idealized, heavily filtered images. As highlighted by Sikis and Tian, these platforms serve as toxic mirrors that fuel constant upward social comparison. This creates a hyper scrutinizing digital environment where immediate like based feedback loops feed a persistent fear of negative evaluation. This brings us to the third phase of the cycle, cognitive loops and rejection sensitivity. When digital pressure meets internal vulnerability, it triggers maladaptive behavior like chronic body checking. As Teng and Pun noted, body checking acts as a cognitive trap because these individuals are highly sensitive to rejection. They mistake their internal insecurities for actual external judgment, locking them into a self-perpetuating downward spiral that deepens their overall social anxiety. Now that we have covered the clinical background, let us look at the structural architecture of our study. As shown on the slide, our framework is divided into three distinct empirical pillars that map out how a young adult moves from perceived external pressure to clinical social anxiety. We begin with our first pathway, self-objectification, which addresses research question 1. Here, we evaluate how looking at oneself through a constant observer's lens impact a young adult's identity. Under our first hypothesis, we propose that higher levels of perceived appearance scrutiny significantly predict a greater degree of objectification. This built on research by Vincent, which shows that when young adults feel constantly observed, they begin to view their bodies as objects to be evaluated, a cognitive shift that acts as the gateway to deeper distress. This brings us to our second pathway, social avoidance, corresponding to our research question 2. Once self-objectification occurs, it manifests behaviorally. We are examining how safety and avoidant behavior, which individuals use to cope with judgment, paradoxically reinforce their social phobia. Our hypothesis states that using active safety behavior like chronic body checking significantly predicts elevated overall levels of social anxiety. Finally, we turn to our third pathway, anxiety severity, representing research question 3. This pathway looks at the predictive power of our model within the dense urban population of the Klang Valley. Our hypothesis asserts that the frequency of perceived scrutiny significantly predicts the overall severity of clinical social anxiety symptoms. By focusing on the Klang Valley, we are examining an environment where digital and physical social comparisons are exceptionally high, allowing us to see how directly the sheer frequency of feeling watched translate to the severity of social anxiety disorders. With our core pathway and hypothesis established, we must ask, what does this study mean in practice? The significance of this work lies in its ability to bridge the gap between academic theory, clinical practice, and public policy. First, our theoretical contribution expand traditional cognitive behavioral models of social anxiety disorder. While historical models focus on general fear of performance, our research refined this framework by integrating appearance-related cognitive errors. We demonstrate that there is a crucial distinction between actual and perceived social evaluation, showing exactly how highly subjective fears of peer judgment act as primary cognitive vulnerabilities that fuel persistent anxiety, even without negative feedback. This theoretical foundation leads directly to our clinical application, specifically targeting maladaptive safety behaviors. Mental health professionals often struggle to find specialized intervention for appearance-centered anxiety. Grounded in the research of Teng and Poon, our study proved that repetitive behaviors like chronic body checking and self-criticism are not protective shield but rather cognitive trap. By mapping this specific pathway, we provide an empirical roadmap for cognitive behavioral therapies to identify these safety behaviors early on, helping young adults replace clinical level self-scrutiny with healthier adaptive coping strategies to break the anxious loop. Finally, we address the systemic level through public policy and digital health. Recognizing that young adults do not develop anxiety in a vacuum, they live in a digitized landscape where aesthetically curated platforms like Instagram and TikTok act as a modern toxic mirrors. Our empirical finding can actively inform policies governing digital networks by demonstrating how aesthetic-driven feeds and metric feedback loops escalate social anxiety disorder. This research provides the concrete evidence needed to lobby for healthier platform design, algorithmic regulation, and digital media literacy. Okay, thank you for my part. My team member Daphne will now continue the presentation. Over to you, Daphne.
Thank you, Rosita Hannah, for that insightful introduction. Now I will continue with literature review. Have you ever felt the weight of strangers' stare? Our research explores perceived appearance-based scrutiny and self-objectifications, exploring how nonverbal judgment deeply impact our mental health. So researcher found that it starts with an external signals, oogling, gazing, and judgmental glances. Studies shows this nonverbal scrutiny triggers more psychological distress and social anxiety than verbal feedback. But the real dangers happens when we internalize these looks. We switch to a third-person vantage point, becoming our own harsh nonverbal assessor. This leads to a chronic body surveillance and constant wary self-monitoring. And this can be shown through a comparison theory, where today visual platforms like Instagram, TikToks act as a high-intensity feedback loops. Anonymous digital gaze, likes and edited images force users to treat their own body as objects to be constantly altered. This is a highly magnified in dense urban area like the Klang Valley. In a collectivistic culture, physical appearance communicates family honors and social status, creating immense environmental pressure to look visually perfect. So, on the surface, this behavior offers instant anxiety relief. They help individuals navigate public spaces. But here is the paradox. This actually a relief that is becoming a trap. By avoiding social habituations, the underlying dread of being stared at goes unchallenged, strengthening the belief that their body is flawed. As anxiety worsens, grooming rituals become highly vigilant. This coping mechanism backfires into an interpersonal level. Peers often misinterpret this kinetic withdrawal and close body posture as being cold or unapproachable. The result? Deepening social isolations and damaged interaction loop. Ultimately, social appearance anxiety is maintained by a powerful parallel system, the cognitive pathway of internalizing a critical gaze and the behavioral pathway of trying to manage it. True healing means to break this loop, moving away from camouflage and stepping back into a genuine connections. Now, have you ever felt an overwhelming distress just thinking about how others judge your body shapes, height, or weight? This isn't just a basic body dissatisfaction. It's a social appearance anxiety or SAA. Research shows a direct predictive path. The frequency of appearance-based scrutiny you face directly predicts the severity of your anxiety. While media and parents set the early benchmark, it is the judgmental peer feedback during young adulthood that carries the heaviest psychological weight. SAA specifically captures the fear of social gaze. Those who score high on the scale often manage this fear to two distinct behavioral coping mechanisms: extreme social withdrawal or exorbitant image altering to control how they are perceived. This pressure intensifies in high density through collectivistic urban environment where maintaining social standing is vital. In crowded public spaces, persistent anonymous visual context transform internalized physical imperfections towards from a personal concern into a social liability, often pushing individuals towards severe embarrassment and isolations. Thank you. Let's move on to Siti Nazira to explain our methodology. Thank you.
Well, thank you so much, Stephanie. So moving on to the methodology. All right. So this study adopted a quantitative research design using a descriptive survey method because the objective is to examine the relationship between perceived appearance-based scrutiny and social anxiety among the young adults. And a cross-sectional approach was employed where the data were collected at one point in time using an online questionnaire created through Google Forms. The target population consisted of young adults aged 15 to 24 years residing in Klang Valley or Selangor, and the participants were selected using a non-probability convenience sampling as it is practical, cost-effective, and allows easy access to respondents who meet the study criteria. A total of 31 respondents, comprising of 9 males and 22 females, participated in this study. To ensure the relevance of the findings, only respondents aged between 15 to 24 years, residing in Klang Valley or Selangor, and able to understand English were included in this study. Moving to the next slide. The data were collected using a structured self-administered questionnaire developed through Google Forms. So the questionnaire consisted of 4 validated psychological skills that measures the main variables in the study. The verbal commentary on physical appearance scale, VCPAS, measured respondents' experiences of appearance-based scrutiny. And the OBCS, or the Objectified Body Consciousness Scale, is to assess the self-objectification or the body surveillance. The Body Image Avoidance Questionnaire, the BIAQ, measured social avoidance and safety behaviors, while the Social Appearance Anxiety Scale, SAAS, measured anxiety related to physical appearance in social situations. The questionnaire was distributed online through WhatsApp, Instagram, Facebook, email to reach the target respondents efficiently. And participations were entirely voluntary, so all respondents were collected anonymously, and the completed questionnaires were prepared for statistical analysis. Moving to the next slide. After the data collection was completed, all responses were extracted from Google Forms and organized using a Microsoft Excel before statistical analysis. So the collected data were summarized using a descriptive statistic, including frequencies, percentages, tables, and charts to provide a clear overview of the respondents' demographic characteristic and questionnaire responses. The ethical considerations were strictly observed throughout this study. The participants were informed about the purpose of the research before completing the questionnaire, and informed consent was obtained prior to the participation. So the participation was completely voluntary, and respondents could withdraw at any time without any consequences. And to protect the participants' privacy, there is no personal identifying information was collected, and all responses remain anonymous and confidential. The collected data were used solely for these academic purposes. As the study involves topics related to body image and social anxiety, mental health support resources were also provided should any participant experience emotional distress. Thank you so much. And moving to the next slide, I'll pass this to my friends, Siti Nurani and Shazi. Over to you.
Thank you, Siti Nazira. Moving on to findings and discussion, where we will dive into the effects of perceived appearance-based scrutiny on social anxiety levels among young adults in the Klang Valley. For this study, we successfully collected data from 31 local young adults and evaluated in using a comprehensive mix of descriptive statistics and path analysis. To walk you through these results, clearly and logically, our findings are organized into the 6 key sections you see outlined on this slide. We will now start by reviewing the demographic profile, then move through our specific analysis for VCPAS, OBCS, BIAQ, and SAAS before finally wrapping up with our hypothesis testing. We move to the overall respondent demographic profile. We have a clear snapshot of our 31 participants. Our sample is predominantly female at 71%, with the vast majority, over 77.4%, falling into the 21 to 24 years old age bracket. Furthermore, this is a highly educated and urbanized group, as over 80.6% are degree holders or university students, and most reside in the key urban centers like Kuala Lumpur and the Petaling district. The main takeaway from this profile is that our findings strongly represent the specific experience of young, highly educated adults navigating life in the urbanized Klang Valley. Next, In this slide, we can examine the gender and the age distribution of our 31 participants. As we can see, on the left-hand side, our sample is predominantly female, making up to 71% of the respondents compared to 29% male, which is highly consistent with previous study involving university students. On the right-hand side of the slide, we can see in terms of age, the vast majority of our participants are emerging adults with over 77% falling into the age bracket of 21 to 24 years old. This specific age profile is crucial to our research as emerging adulthood is a critical developmental stage known to be closely associated with heightened body image concerns and social anxiety. Next slide. The residential locations of our 31 participants, as the chart indicates, a significant majority live in a highly urbanized area of the Klang Valley, with nearly 39% residing in Kuala Lumpur and another 29% in the Petaling district. The main takeaway here is that because urban environments naturally foster greater social interactions, our sample is drawn from a population that is inherently exposed to higher levels of social evaluation and appearance-related scrutiny on daily basis. Moving on to the next slide. The educational background of our 31 respondents. As the chart illustrates, we are looking at a high educated sample with an overwhelming majority, over 80%, being degree holders or current university students, followed by nearly 10% who hold diplomas. The key takeaway here is that having a participant pool primarily composed on university students and graduates make the demographic highly relevant for exploring our study's core objectives regarding appearance-based scrutiny, self-objections, and social anxiety. Now we move to the next slide. This part of our presentation shows we measure our respondents' response. This slide presents the findings from the VCPAS of the frequency and on the frequency of appearance-based comments and their emotional impacts on young adults. We recognize that our current findings are constrained by a small sample size of 31 respondents, potential biases for self-reported data, and a geographical restrictions to the Klang Valley, and a cross-sectional design that limits our ability to prove direct cause and effect. On the left, the result shows that the most frequently received comments were, your outfit looks incredible on you, with a mean of 3.65, followed by comments about body weight changes, appearance changes, and eating habits. In contrast, consider cosmetic surgery was the least frequently received comment, with the lowest mean of 1.48. On the right, we can see that the comments causing the greatest emotional distress with negative in nature. The most emotionally harmful comment was, you look bad without makeup, with the highest mean of 4.16, followed by comments about body weight, clothing, and cosmetic surgery. Overall, these findings suggest that with appearance-related comments are common, negative comments have much stronger emotional impact, contributing to feelings of insecurity and lower self-esteem among young adults. Now I pass over to Siti Norbani to present the next slide onwards. Thank you.
Thank you, Shazlina, for the passing. So we move on to the OBCS findings, which is self-objection, where we examine our findings from the Objectified Body Consciousness Scale, OBCS, which measures objectification through body surveillance, body shame, and self-monitoring behavior. Our case finding reveals that the respondent frequently monitor their daily appearance and that higher exposure to appearance-based comments is strongly linked to greater self-objectification, causing individuals to view themselves primarily from an outsider perspective. As you can see at the slide, the results strongly support the objectification theory by illustrating a direct pathway. By receiving external appearance-based comments lead to the internal objectification, which then triggered increased body surveillance and shame. Ultimately, the placing of the young adult at much higher risk of social anxiety today. Next slide. So we're moving on to the BIAQ findings, which is the data revealed that the young adult frequently engage in specific action to hide from judgment, such as meticulously managing their clothing choices, keeping out the social activities, restricting their eating, and constantly checking their bodies in mirror or photos. While the respondent often rely on these appearance management strategies as short-term coping mechanism in situations where they might evaluate our findings, highlight to a critical drawback. Rather than helping this avoidance behavior ultimately backfires and end up reinforcing their underlying anxiety over time. And then we go to the next slide. We will look at our findings from the Social Appearance Anxiety Scale, which is SAAS. Our data shows that this type of anxiety primarily manifests as an intense fear of judgment, causing individuals to feel highly nervous in social situations and remain constantly preoccupied with how others perceive them. Crucially, we found that they experience higher levels of appearance scrutiny is directly tied to a greater fears of negative evaluation, heightened social anxiety symptoms, and a deeper negative impact on overall emotional well-being. Ultimately, this reinforces our core conclusion that perceived appearance-based scrutiny is major driving force behind the increasing levels of social anxiety among young adults in the Klang Valley. So we're moving on to the next slide, which is the hypothesis testing. We are pleased to report that all the three of our core hypotheses are fully supported by the data. First, we confirm a significant positive relationship between perceived appearance-based scrutiny and self-objectification. Secondly, the results showed that the engaging in safety behavior is significantly and positively linked to experiencing social anxiety. Finally, we proved that the intensity of appearance-based scrutiny is directly related to the severity of that social anxiety. Overall, this significant positive relationships confirms that appearance scrutiny and safety behavior are major in intertwined drivers of self-objectification and social anxiety among young adults in the Klang Valley. And moving on to the summary of the finding, we discovered that the appearance-related comments are incredibly common among a young adult with negative remark carrying a particularly strong emotional impact. As this scrutiny increases, it directly predicts higher rates of objectification, which in turn triggered avoidance behavior that heavily contribute to social anxiety. As you can see, this clear progression in our relationship model on the right side, moving from external scrutiny to internal self-objectification, leading to avoidance and finally resulting in feeling worry and fear. Ultimately, our overall conclusion confirmed that perceived appearance-based scrutiny plays a highly significant role in driving up social anxiety among young adults in the Klang Valley. And we're moving on to the conclusion. To summarize our conclusion, this study successfully showed how the people feeling judged about one appearance directly drive social anxiety in young adult. The biggest takeaways is that when young adult feel scrutinized they begin to objectify themselves, avoid social situation, and ultimately experience much higher levels of social anxiety. These specific findings confirm the vicious cycle, proving that external judgment lead to self-judgment and avoidance behavior, which in turn predict more severe anxiety symptoms. These research highlight a psychological trap where the fear of judge feels safety behavior that actually make the social anxiety become worse. And the research conclusion, turning into this research conclusion, the key findings clearly outline the pathway from the perceived judgment to the anxiety. We discovered that perceived appearance-based scrutiny is directly linked to self-objectification and resulting the avoidance and safety behavior act as significant predators of overall social anxiety. Furthermore, the more frequently young adult feel scrutinized, the more severe their anxiety symptoms become. This study identifies a distinct psychological cycle in Climb Valley where appearance-based scrutiny drives self-objectification and social withdrawal, culminating in higher levels of social appearance anxiety. Moving on to the practical of the implication about this study. Our findings offer actionable takeaways for 4 key groups. For the universities and mental health professionals, this insight can guide the development of better screening tools, targeted counseling, and awareness program focused on body positivity and early intervention. Next, on a broader scales, social media platform and policymakers can use this data to champion responsible content, regulate harmful comparison cultures, and normalize diverse body representation. For the young adult themselves, they're applying these research encourage self-acceptance and the development of healthier coping strategies, all of the work together to create supportive environment that reduce appearance pressure and improve overall mental well-being. Thank you for listening for our presentation.